Welcome back to the Vital Signpost. Today, we're going to really get into something that's pretty essential to nursing.
Yeah, something foundational.
Yeah, fluid and electrolyte balance.
hmm
Whether you are, just starting out in nursing school or you've been doing this for years, um, understanding this delicate dance that goes on in the body is really important for giving the best patient care.
It's true. You can think of your body as this like fine-tuned machine, and every process relies on having the right balance of fluids and electrolytes.
Right, from muscle function to nerve impulses to keeping that heartbeat going.
Keeping a steady heartbeat.
It's actually quite remarkable when you think about it. All this going on behind the scenes, keeping everything going how it should.
Absolutely.
But let's start with the basics.
Yeah.
Okay,
Let's
slow.
break it down. We'll begin with a fundamental concept, total body water, or TBW for short.
Okay.
And this refers to the total amount of water in your body, which makes up a surprisingly large percentage of your body weight.
It's more than I think most people realize. For a healthy adult, we're talking about 60% of their body weight is water.
That's a lot.
That's a whole lot of H2O.
It's true. And now this water isn't just sloshing around randomly. It's carefully organized into compartments.
Okay.
We call those intracellular and extracellular.
So like separate rooms in a house.
Exactly. The intracellular compartment, or ICF, is the fluid that's found inside our cells, and it makes up about 2/3 of our total body water.
Okay.
The remaining third is the extracellular fluid, or ECF, and that's what bathes the outside of our cells.
Okay, so we have these distinct fluid compartments, each with its own unique composition, but I imagine they're not completely isolated from each other.
No, they're not.
How do fluids and electrolytes move between these different compartments?
That's where things get really interesting. Fluids and electrolytes are in constant motion flowing between compartments to maintain equilibrium.
Okay.
And this movement is governed by several key processes. We've got diffusion, osmosis, filtration, and active transport.
Okay, so there's a lot going on.
There is.
Let's take a closer look at each of these processes.
Okay.
Diffusion seems like a good place to start.
Yeah.
It's the movement of molecules
Uh-huh.
from an area of high concentration to an area of low concentration, right?
Chris,
Kind of like how if you spray perfume, it spreads throughout the room.
yeah, like if you open a bottle of perfume on one side of the room, eventually everyone in that room is going to smell it. Even though those molecules initially were concentrated near the bottle,
Right.
that's diffusion in action.
It's like those molecules are trying to spread out and give themselves some space.
Mm-hmm.
Now, osmosis is a bit different, isn't it?
Yeah, it is.
It specifically involves the movement of water across a semi-permeable membrane.
Yes, osmosis is a really fascinating process that's absolutely crucial for maintaining fluid balance. Think of it like this. Imagine you have two containers of water that are separated by a membrane, and only water can pass through this membrane. Now, if one container has a higher concentration of solutes, things like salt or sugar water, is naturally going to move from the area of lower solute concentration to that area of higher solute concentration,
Oh.
trying to kind of dilute it until both sides are equal.
That's like those water molecules have a sixth sense for balance.
Exactly, always striving for that equilibrium.
Okay, now what about filtration?
So filtration involves the movement of water and small solutes across a membrane from an area of high pressure to an area of low pressure. Think of it like using a strainer to separate pasta from the water.
Okay.
The water and those small particles can pass through the strainer, while that larger pasta, it stays behind.
I like that analogy.
Yeah. So in our bodies, filtration is driven by pressure gradients, pushing those fluids and small solutes across membranes.
Makes sense. Okay, so we've got diffusion, we've got osmosis, we've got filtration. What about active transport?
So active transport is a little bit like swimming upstream. It requires energy to move those molecules against their concentration gradient from an area of low concentration to an area of high concentration.
So instead of just going with the flow, it takes a lot of work.
Yeah, it does. Active transport is essential, though, for maintaining that proper balance of electrolytes inside and outside of our cells.
Wow, so we've covered these four processes that govern fluid and electrolyte movement, diffusion, osmosis, filtration, and active transport.
We have.
But what about the bigger picture? What controls how much fluid our bodies hold on to or let go of?
So our bodies have this really intricate system of checks and balances that regulate fluid balance, ensuring that we retain or excrete fluids as needed.
Okay.
This system involves a few key players: the thirst mechanism, antidiuretic hormone, or ADH, and aldosterone.
Okay, let's start with thirst. I mean, that one seems pretty straightforward.
Yeah.
It's our body's way of telling us, hey, you need a drink.
Exactly when our bodies sense a decrease in fluid volume or an increase in solute concentration, It triggers that thirst mechanism, prompting us to drink.
Okay, and ADH, I remember learning about this in school. It's a hormone that's produced in the brain, and it plays a key role in regulating water balance.
That's right. ADH, also known as vasopressin, is released from the pituitary gland, and that's in response to increased blood osmolality,
Okay.
which basically means that the concentration of solutes in our blood is too high.
Oh,
ADH acts on the kidneys, telling them to reabsorb water back into the bloodstream instead of letting it be flushed out as urine.
okay.
So this helps to conserve water and dilute the blood.
So it's like a water conservationist?
Exactly, making sure our bodies hold on to those precious fluids when we need them.
Okay, what about aldosterone?
Aldosterone is another hormone that's involved in fluid balance, and it's produced in the adrenal glands, which sit on top of our kidneys.
Right.
It plays a crucial role in regulating sodium and potassium levels.
Yeah, we know how important those electrolytes are.
hmm So when blood pressure drops, or sodium levels are low, aldosterone steps. It acts on the kidneys, signaling them to reabsorb sodium back into the bloodstream.
Okay.
Water follows sodium, so this helps to increase blood volume and, in turn, blood pressure.
So it's like this chain reaction aldosterone promotes sodium reabsorption, which leads to water retention and ultimately helps to maintain blood pressure.
Exactly.
It's amazing how these hormones work together to keep everything balanced.
It really is a very delicate dance.
So we've covered a lot of ground already, from the basics of total body water and fluid compartments to, osmosis, diffusion, filtration, active transport, the roles of thirst, ADH, and aldosterone.
Mm-hmm.
But I think it's time we shift gears a little bit
Okay.
and talk about those electrically charged minerals that play such crucial roles in our bodies. Electrolytes.
Sounds good. Electrolytes are essential for a whole range of bodily functions, from nerve impulse transmission and muscle contraction to maintaining that fluid balance and regulating our heartbeat.
And just like with fluids, having the right balance is key.
That's right.
Too much or too little of any electrolyte can cause problems.
And that's what we'll dive into next. The specific roles of some key electrolytes like sodium, potassium, calcium, and magnesium, and what happens when those levels get out of whack.
Okay, sounds good.
All right. So let's start with potassium. Shall we? Potassium is like a real workhorse in the body. It's the most abundant electrolyte inside our cells, and it's involved in so many vital functions.
It's like the ultimate multitasker.
Yeah.
What are some of its key roles?
Well, for starters, potassium is crucial for muscle contraction. Every time you move a muscle, potassium ions are flowing in and out of your muscle cells, helping to generate those contractions.
Really, I never realized potassium was so involved in something as basic as movement.
It's also essential for transmitting nerve impulses. You know, those electrical signals that are zipping around your nervous system, allowing you to think and feel and react to the world around you. Well, potassium plays a key role in those too.
So it's like the conductor of our nervous system orchestra.
And it's not done yet. Potassium also helps to regulate our heartbeat, keeping those electrical impulses firing in a steady rhythm. And it also plays a role in maintaining fluid balance and acid-base balance, making sure our internal environment stays within a healthy range.
Wow, potassium really does wear a lot of hats. It sounds like having the right balance is crucial for overall health. What happens when those levels get out of whack?
That's when we start to see problems. Too little potassium, which is known as hypokalemia, can cause a whole range of symptoms, from fatigue and muscle weakness to more serious complications like cardiac arrhythmias and even
It
paralysis.
sounds pretty serious. What causes hypokalemia?
There are a number of potential culprits. Certain medications, like diuretics, which help to flush excess fluid from the body, can lead to potassium loss conditions like vomiting and diarrhea, can also deplete potassium levels, as can certain hormonal imbalances.
So it's something we really need to be mindful of, especially in patients who are taking diuretics or experiencing, significant fluid loss. What about the other end of the spectrum? What happens when potassium levels get too high?
That's called hyperkalemia, and it can be just as serious as hypokalemia. Hyperkalemia can disrupt heart rhythm, leading to potentially life-threatening arrhythmias.
So whether it's too high or too low, it can spell trouble for the heart. What are some of the common causes of hyperkalemia?
Kidney failure is a major risk factor for hyperkalemia. The kidneys are responsible for filtering excess potassium out of the bloodstream. So if they're not functioning properly, potassium can build up certain medications like potassium-sparing diuretics, and some blood pressure medications can also contribute to hyperkalemia.
Okay, so monitoring potassium levels is crucial, especially in patients with kidney problems or those taking certain medications.
It is.
Now let's move on to another key, electrolyte sodium.
Sodium, also known as natrium, is the most abundant electrolyte in the extracellular fluid. It plays a vital role in regulating fluid balance, nerve impulse transmission, and muscle function.
Okay, so it's like the life of the extracellular party. What happens when sodium levels get too low?
That's called hyponatremia, and it can be caused by a variety of factors, including excessive sweating, prolonged vomiting or diarrhea, certain medications, and even excessive water intake.
So drinking too much water can actually be a problem.
Yeah, it can in certain situations. If someone drinks a huge amount of water very quickly, it can dilute the sodium in their bloodstream, leading to hyponatremia.
That's kind of counterintuitive. We're always told to stay hydrated.
I know, right?
What are some of the symptoms of hyponatremia?
Well, early symptoms can include things like headache, fatigue, nausea, muscle cramps. As hyponatremia worsens, you might see confusion, seizures, and even coma. It can be very serious, especially if it develops rapidly.
Okay, so we need to be mindful of both ends of the spectrum. What about when sodium levels get too high?
That's called hypernatremia, and it's often related to dehydration. It can also be caused by conditions that affect the body's ability to regulate sodium, like diabetes insipidus or Cushing's syndrome.
So it's essentially too much sodium for the amount of fluid in the body.
Yeah, exactly. And the symptoms of hypernatremia can range from mild, like thirst and restlessness, to more severe, including confusion, seizures, and coma.
Okay, so both hyponatremia and hypernatremia can have serious consequences.
They can.
Now, we've talked about potassium and sodium, two of the major electrolytes in our bodies. Let's move on to calcium.
All right, calcium is probably best known for its role in building strong bones and teeth.
Right.
But it's also essential for a whole range of other functions, including muscle contraction, nerve transmission, blood clotting.
It's not just about strong bones, then.
No, not at all. Calcium is a busy mineral, so when calcium levels are too low, a condition we call hypokalemia, it can lead to muscle cramps, tingling sensations, and even seizures.
What are some of the common causes of hypokalemia?
It can be caused by conditions that affect the parathyroid glands, which play a key role in regulating calcium levels. Vitamin D deficiency can also lead to hypokalemia, as can certain medications and kidney disease.
Okay, so if someone's experiencing muscle cramps or tingling, it's worth considering the possibility of hypokalemia. What about when calcium levels get too high?
That's called hyperkalemia, and it can be caused by a number of things, including overactive parathyroid glands, certain types of cancer, and even excessive intake of calcium or vitamin D.
So even too much of a good thing can be a problem. What are the signs and symptoms of hyperkalemia?
Hyperkalemia can cause a variety of symptoms, including fatigue, weakness, nausea, constipation, and even kidney stones and bone pain in severe cases. It can lead to confusion, coma, and cardiac arrhythmias.
Wow. Okay, so both hypokalemia and hyperkalemia can have some serious consequences. Now let's move on to the last electrolyte on our list, magnesium.
Magnesium is another one of those essential minerals. It plays a role in over 300 enzymatic reactions in the body.
Wow.
Yeah, it's involved in muscle and nerve function, blood sugar control, blood pressure regulation, and even protein synthesis.
Magnesium's a real overachiever then. It seems like it's involved in just about everything.
It really is. And just like with the other electrolytes, having the right balance of magnesium is crucial for good health.
So what happens when magnesium levels get out of whack?
When magnesium levels are too low, a condition known as hypomagnesemia, it can cause a range of symptoms, including fatigue, muscle cramps, tremors, and even seizures in severe cases. It can lead to cardiac arrhythmias.
Okay, what causes hypomagnesemia?
It can be caused by a number of things, including inadequate dietary intake, alcoholism, chronic diarrhea, and certain medications like diuretics and proton pump inhibitors.
Okay, so it's something to be aware of, especially in patients with those risk factors. What about when magnesium levels get too high?
That's called hypermagnesemia, and it's less common than hypermagnesemia. It usually occurs in people with kidney failure, as the kidneys are responsible for excreting excess magnesium. It can also be caused by overuse of magnesium-containing laxatives or antacids.
What are the symptoms of hypermagnesemia?
Hypermagnesemia can cause nausea, vomiting, muscle weakness, low blood pressure, slow heart rate in severe cases. It can lead to respiratory depression and cardiac arrest.
So just like with the other electrolytes, both hypomagnesemia and hypermagnesemia can have serious consequences if left untreated.
Absolutely, and this really highlights the importance of understanding the roles of these key electrolytes and how to recognize the signs and symptoms of imbalances. As nurses, we're often the first line of defense in identifying and managing these issues.
Absolutely. We've covered a lot of ground today, talking about the importance of fluid and electrolyte balance and the specific roles of potassium, sodium, calcium, and magnesium. But before we wrap up this part of our deep dive, let's shift gears a little and discuss acid-base balance.
Sounds good. Acid-base balance is another crucial aspect of maintaining that stable internal environment. It refers to the balance between acids and bases in the body, which is essential for optimal cellular function. Even slight deviations from this balance can have significant consequences.
Okay, so let's break down this concept of acid-base balance. What exactly are acids and bases?
So an acid is a substance that can donate a hydrogen ion or proton, while a base is a substance that can accept a hydrogen ion.
So it's all about these hydrogen ions bouncing around.
Essentially, yes. The concentration of hydrogen ions in a solution determines its acidity or alkalinity.
And how do we measure this acidity or alkalinity? I've heard of the pH scale, but I'm not really sure I remember all the details.
Yeah, the pH scale is a way to measure the acidity or alkalinity of a solution. It ranges from 0 to 14, with 7 being neutral. A pH below 7 indicates acidity, while a pH above 7 indicates alkalinity.
So the lower the pH, the more acidic the solution.
Exactly. And the higher the pH, the more alkaline or basic the solution.
Okay, that makes sense. What's the ideal pH for our bodies? I mean, we don't want to be too acidic or too alkaline, right?
You're right. Our bodies function best within a very narrow pH range. The normal pH range for our blood is between 7.35 and 7.45, which is slightly alkaline.
So our blood likes to be just a tad on the basic side. What happens when our blood pH falls outside of that range?
When the pH of the blood falls below 7.35, it's called acidosis. And when it rises above 7.45, it's called alkalosis. Both acidosis and alkalosis can disrupt normal bodily functions and lead to a variety of health issues.
So our bodies have a lot riding on maintaining that delicate pH balance. What are some of the things that can throw our acid-base balance off?
Acidosis can be caused by a number of things, including respiratory problems that impair carbon dioxide removal, such as emphysema or chronic obstructive pulmonary disease, also known as COPD. It can also be caused by metabolic conditions like diabetic ketoacidosis or kidney failure.
So if the body can't get rid of enough carbon dioxide, it becomes more acidic.
Precisely. And in cases of diabetic ketoacidosis, the body produces excess ketones, which are acidic alkalosis, can be caused by things like hyperventilation, prolonged vomiting, and certain medications like diuretics.
So if the body loses too much acid, it becomes more alkaline.
Exactly. And in cases of hyperventilation, the body expels too much carbon dioxide, leading to a decrease in carbonic acid, shifting the pH balance towards alkalosis.
Okay, so both acidosis and alkalosis can have a variety of causes, and both can disrupt the body's equilibrium. How does the body regulate this delicate acid-base balance? How do we stay within that narrow pH range?
Our bodies have several mechanisms to maintain acid-base balance. The lungs, the kidneys, and various buffer systems in the blood all work together to keep our pH in check.
It's like a three-pronged defense against pH imbalances.
Exactly. Let's start with the lungs. The lungs are responsible for regulating carbon dioxide levels in the blood. Carbon dioxide is acidic, so when levels rise, it makes the blood more acidic.
Okay, that makes sense. But how do the lungs actually do this? I mean, we breathe in oxygen and breathe out carbon dioxide, but how does that affect pH?
When carbon dioxide levels in the blood rise, making it more acidic, our breathing rate increases to expel more carbon dioxide. This helps to lower the acidity and bring the pH back towards normal.
So our lungs are like a built-in pH regulator.
Exactly. And when carbon dioxide levels fall, making the blood more alkaline, our breathing rate slows down to conserve carbon dioxide and bring the pH back down.
Wow. It's amazing how our bodies can make these subtle adjustments to maintain balance. Now, what about the kidneys? How do they contribute to acid-base balance?
The kidneys play a crucial role by excreting excess acids or bases in the urine. They can also reabsorb bicarbonate, a base, back into the bloodstream if needed.
So the kidneys are like a filtration system, fine-tuning the pH of our blood by getting rid of excess acids or bases.
You got it. And then we have the buffer systems in the blood, which act like chemical sponges, soaking up excess acid or base to prevent those sudden shifts in pH.
So it's like a three-tiered defense system. The lungs regulating carbon dioxide levels, the kidneys filtering and excreting excess acids or bases, and the buffer systems acting as chemical shock absorbers.
Precisely. And when all these systems are functioning properly, they help to maintain our acid-base balance within that narrow, healthy range.
Okay, so we've covered the basics of acid-base balance and the key players involved in keeping our pH in check. But how does all of this relate to nursing care? I mean, how do we actually apply this knowledge in real-world situations?
That's a great question. Understanding acid-base balance is crucial for providing safe and effective care to our patients. We need to be able to recognize the signs and symptoms of acid-base imbalances, interpret lab values like arterial blood gases, and implement appropriate interventions, whether it's adjusting ventilator settings, administering medications, or simply providing supportive care.
It sounds like we'll need to delve deeper into the practical aspects of assessing and managing acid-base imbalances in our next segment. I'm looking forward to exploring those real-world applications.
I agree. It's one thing to understand the theory, but it's another to put that knowledge into action at the bedside.
Welcome back to the Vital Signpost. We've been on this journey exploring fluid and electrolyte balance, and now it's time to tackle the real-world applications of what we've learned.
Yeah, absolutely. Time to bridge that gap between theory and practice and see how we as nurses can really use this knowledge
To provide the best care.
to provide the best possible care for our patients.
So let's start with assessment. We've talked about, gathering a thorough patient history, including medical conditions, medications, diet, you know, any recent episodes of fluid loss. But what are some, specific signs and symptoms that might clue us in to a potential fluid or electrolyte imbalance?
Well, that's where our keen observation skills come in. We need to be really attuned to those subtle cues that might indicate an imbalance.
Right.
For example, changes in mental status like confusion or lethargy can be early signs of electrolyte disturbances, particularly hyponatremia or hypernatremia.
So a patient who was previously alert and oriented,
Mhm.
starts becoming confused or difficult to arouse, that's a red flag.
Absolutely warrants further investigation. We also need to pay close attention to vital signs. Changes in blood pressure, heart rate, respiratory rate can give us really valuable insights.
Right, like a rapid heart rate could indicate dehydration,
Exactly.
while a slow heart rate might be a sign of hypermagnesemia or hyperkalemia.
Precisely. And don't forget about urine output. Decreased urine output can be a sign of dehydration or kidney problems, both of which can lead to electrolyte imbalances.
Okay, so we're watching for changes in mental status, monitoring vital signs, keeping an eye on urine output. What about physical assessment? Are there things we should be looking for there?
Absolutely. Assessing skin turgor can give us clues about a patient's hydration status.
Okay.
If the skin tense when you gently pinch it, could indicate dehydration.
Like checking a peach.
Exactly.
We also need to assess the mucous membranes for dryness,
Right.
which could also indicate dehydration.
And we should also be aware of any neuromuscular signs and symptoms.
Right.
Things like muscle weakness, cramps, tremors, or even seizures can be manifestations of electrolyte imbalances.
It's like putting together a puzzle. you know?
Yeah.
We're gathering information from their history, their vital signs, physical assessment lab tests to try to get a clear picture.
Exactly. And once we've gathered all those pieces, we can start formulating a plan of care. This might involve a range of interventions from simple things like encouraging fluid intake or adjusting medications to more complex therapies like intravenous fluids or dialysis.
Okay, let's talk about intravenous fluids for a minute.
Okay.
We've discussed, the different types earlier, crystalloids, colloids, blood products. But how do we decide which type of fluid a patient needs?
Choosing the right intravenous fluid is a critical decision, and it depends on a lot of factors, including the type of fluid or electrolyte imbalance, the patient's overall condition, and any underlying medical conditions they might have.
Right.
So, for example, if a patient is dehydrated from vomiting and diarrhea, we might choose an isotonic crystalloid like normal saline or lactated wingers
Okay.
to replace those lost fluids and electrolytes.
Okay, that makes sense. Those isotonic solutions help to restore fluid volume without causing major shifts.
Right.
The electrolytes, what about colloids? When would we use those?
So colloids like albumin are larger molecules that stay within the blood vessels and help to draw fluid back into the circulation.
Right.
They're often used in situations where we need to quickly expand plasma volume,
Right.
such as in cases of shock or severe burns.
So they're like little fluid magnets.
Yeah, that's a good way to think about it. And of course, blood products like packed red blood cells are essential for patients who've experienced significant blood loss.
Right. Blood transfusions can be life-saving in those situations.
They can.
Now let's talk about medications. We briefly discussed diuretics and other medications that can affect fluid and electrolyte balance. But can we delve a bit deeper?
Sure. Diuretics are medications that increase urine output,
Right.
helping to remove excess fluid from the body.
Right.
They're often used to treat conditions like hypertension, heart failure, edema.
But as we talked about earlier, they can also lead to electrolyte imbalances, particularly hypokalemia.
Yes. That's why it's so important to monitor electrolyte levels closely in patients taking diuretics.
Right.
We might also need to prescribe potassium supplements to prevent or correct hypokalemia.
Okay, so they're kind of like a double-edged sword.
They are?
They can be helpful for managing fluid overload,
Yeah.
we got to be careful.
With you.
Now, we also need to be mindful of other medications that can affect electrolytes,
Absolutely.
like some blood pressure medications, ACE inhibitors, angiotensin receptor blockers can cause hyperkalemia.
Hmm.
So it's really important to be aware of the potential electrolyte effects of all the medications our patients are taking.
It is.
Now, let's shift gears a bit and talk about patient education.
Okay.
We mentioned this earlier, but I think it deserves a little more attention. How can we empower our patients to take an active role in managing their fluid and electrolyte balance?
Patient education is a cornerstone of nursing care, and it's especially important when we're talking about fluid and electrolyte balance.
Right.
We need to equip our patients with the knowledge and skills they need to stay healthy and prevent complications.
Okay, so what are some key points we should be teaching?
Well, first and foremost, we need to emphasize the importance of staying hydrated, especially during hot weather or when they're ill. We can encourage them to drink plenty of fluids throughout the day and to recognize those early signs of dehydration like thirst, dry mouth, decreased urine output.
Okay, staying hydrated. What else?
We can also teach them about the importance of a balanced diet that includes plenty of fruits, vegetables, and other sources of electrolytes.
Getting those essential minerals.
Mm-hmm.
What about medications? Should we be educating them about potential electrolyte effects?
Absolutely. We need to make sure they understand those potential side effects of their medications, especially diuretics,
Right.
and how to recognize the signs and symptoms of electrolyte imbalances.
Mm.
And we should encourage them to report any unusual symptoms to their healthcare provider right away.
So we're really empowering our patients to be active participants in their care, advocating for themselves and seeking help when they need it.
Exactly. We're not just treating their medical conditions, we're building partnerships with them to help them achieve optimal health and well-being.
This has been an incredibly informative journey.
Yeah.
We've explored, the intricacies of fluid and electrolyte balance from the cellular level to the whole body perspective. And we've discussed how we as nurses can apply this knowledge to provide the best possible care.
It's been a fantastic deep dive, and I hope our listeners have gained a deeper appreciation for the importance of fluid and electrolyte balance.
I think we've covered a lot of ground today, but before we sign off, I'd like to leave our listeners with a few key takeaways.
Okay.
First and foremost, I think it's crucial to remember that fluid and electrolyte balance is dynamic.
It is.
It's not static. It's always changing, responding to internal and external cues.
Absolutely. Our bodies are constantly working to maintain equilibrium.
And as nurses, we need to be attuned to those subtle changes that might indicate an imbalance.
Yeah.
We need to be vigilant in our assessments, monitoring vital signs, observing for physical signs and symptoms, reviewing lab results.
Absolutely. Early detection is key to preventing complications.
And we need to remember that fluid and electrolyte imbalances can affect patients of all ages and backgrounds.
That's right. It's not just a concern for older adults or those with chronic illnesses. Anybody can experience an imbalance, especially under certain conditions.
Right.
Things like prolonged vomiting or diarrhea, excessive sweating, certain medications.
So it's something we need to be aware of in all of our patients. And lastly, I want to emphasize the importance of patient education. We need to empower our patients to understand their bodies.
Absolutely.
And take an active role in maintaining their health.
I couldn't agree more. Knowledge is power. And when we equip our patients with the right information, they can become active participants in their care, helping to prevent complications and promote well-being.
Well, I think that's a great place to end this episode of the Vital Signpost. Thanks for joining us on this deep dive into fluid and electrolyte balance.
It's been a pleasure. Until next time, stay hydrated, keep those electrolytes balanced, and never stop learning.